We want to take you back to the latest on the coronavirus outbreak now. The end of a coronavirus quarantine on a cruise ship in Japan is adding uncertainty to the outbreak that started in China and has spread around the world. CBS News foreign correspondent Deborah Pata is at the port in Yokohama, Japan, where that cruise ship docked more than 2 weeks ago.
Japan has been criticized by some medical experts who say their quarantine methods led to a further spread of the virus. But Community Health Director Dr. Shigeru Omi has documents from the Ministry of Health showing most of the transmissions occurred before the quarantine began.
There's always delay, sometimes 1 day, 2 days, or sometimes even 1 week or 2 weeks.
So should they not have tested everyone right at the beginning?
Well, it takes something, it takes 6 hours.
Omi says it is a dishonest disease because it's often transmitted asymptomatically.
I could be totally overwhelmed and gnash my teeth and scream and cuss and cry, but wow, if that's really what it's going to be, then that's what it's going to be.
Jerry Jorgensen from Utah is one such patient. Hospitalized on Valentine's Day, she tested positive but has had none of the symptoms of the virus. Already, over 300 Americans on board the ship were flown back to the U.S. on Monday. They are in quarantine around the country to prevent the spread of coronavirus in the U.S. Like Cheryl and Paul Molesky, who are at Lackland Air Force Base near San Antonio, Texas. CBS News spoke to them as health officials from the CDC checked their condition.
So we're with CDC. We're just coming around to do your nightly temperature checks and ask about symptoms.
The Moleskys were transported from Japan on a plane with other evacuees, some who were at a higher risk for having the virus.
Truly horror, to tell you the truth. It was a nightmare. So we were sitting with sick people.
And the restrooms were behind that. So you had to walk by all the sick people to get your food or get to the restroom.
Tanya Basu is a senior reporter covering humans and technology at MIT Technology Review. She's joining me now to talk about a really interesting aspect to this story, social media and the role that it has played when it comes to misinformation and the coronavirus. I know I've certainly seen a lot of very good information on social media, but also, frankly, some bad information and racist information on social media about this coronavirus. So you've got this word, infodemic. Tell me what that means and why is it potentially harmful?
Yeah, so the World Health Organization developed the word infodemic, and basically it combines information and pandemic. And the idea is that there's such an overabundance of information available that people can't really discern, is it right, is it true, is it reliable? And all that information is really making it hard for people to figure out what's actually going on and what is something that they should do to protect themselves.
So, what are the real world consequences of this sort of misinformation?
You mentioned the racism, and I think that's a really important thing to pay attention to. When you're seeing a lot of reports of people, even in the United States, who are saying that I'm Asian, I haven't gone to China recently, and I'm getting a lot of attacks. I'm being targeted, and people are looking at me strange because I'm Asian, and they think that I might be coughing, and that means I've got coronavirus. So that's definitely a very dangerous situation. On the ground, there's a lot of panic. People are spreading fake news and spreading things that aren't true, conspiracy theories about the coronavirus that ultimately make it really difficult for health authorities to address the epidemic on the ground.
So, but the thing about social media is it's also, shown itself to be a very valuable tool when it comes to getting good information out, valued information out. And certainly when we're dealing with China, we know it's sort of a very restrictive environment when it comes to media. And we here have been able to see exactly what's happening in China because of social media. Regular citizens videotaping their walk to work or the empty subway cars or whatever. And so you don't want to just shut it down completely. So I'm wondering, what are companies doing to sort of suss out the good and the bad and shut down the misinformation and keep the accurate information flowing?
You're absolutely right, especially in a country like China where censorship is huge and authorities were trying to tamp down information and criticism. Social media has been extremely helpful in potentially actually containing the virus within Wuhan. But with companies like Facebook and Twitter, a lot of the information has just spread so rapidly that it's been difficult to tamp down. the World Health Organization is working with these social media companies. So if you're searching for the coronavirus, that information you are led to information that is coming from the WHO or reliable sources of information, rather than maybe someone who's creating videos that might not be, meant to inform. But it's difficult. The flow of information is so fast. I can make a video right now saying something about the coronavirus that's not true, and honestly, it'll probably take some time before the social media companies would take it down. So it's both good and both bad.
Yeah, and there's also sort of this other role. So we have relatives that are living in China now. They're over there teaching English, and it's a cousin. She's there with her whole family. She has 2 little kids, and quite frankly, we would not have known what was going on with her if it was not for social media. So she was sort of uploading daily videos of how they're spending their time, particularly during the New Year's holiday when they couldn't go anywhere at all. And so I want you to talk a little bit about the support system that is social media for the people who were impacted by the coronavirus.
Yeah, this is something my colleague and co-author Karen wrote about, Karen Howe, and she said that basically a lot of people are finding solace through social media. It feels very alone to be locked into a house, even for the people who are stuck on the ship and quarantined. It's very alone and it's very lonely, and it's very isolating to be stuck and to be, told you might have a virus that is, causing panic around the world. So a lot of these people are using social media to connect with each other. Like you mentioned, this was during the Lunar New Year in China, which is a time of family gathering and celebration. And that was something that a lot of people could not do. And social media was able to connect these families who otherwise would be together and celebrating. So in a way, despite the misinformation, despite the fact that there's racism going on, even within China, of people coming from Wuhan, the connecting power of social media for these families and for these people who are struggling with being alone and being told that they could have this dangerous virus, it's been very powerful and supportive to see.
Yeah, I encourage people, when they see that headline on their social media feed, just ask some questions, do some follow-up research, find a legitimate news source before you believe all that you read there. Tanya Basu, thank you so much.
You're welcome. Thank you very much for having me.